Welcome to PAPERI Bright Minds, where we spotlight visionary leaders shaping the future of pediatric oncology, genomics, and global health. This session, we are honored to feature a visionary in global pediatric oncology, Dr. Carlos Rodriguez-Galindo, Executive Vice President of St. Jude Children's Research Hospital and Director of St. Jude Global. He leads one of the world's most ambitious efforts to close the survival gap for children with cancer, no matter where they live.
Hello, everyone, and welcome to the PAPERI Bright Minds series, where we spotlight visionary leaders shaping the future of science, health, and equity across Africa and beyond. I'm Wafa Rashid, founder and chair of Pan-African BGS Education and Research Initiative, PAPERI, and I am delighted to welcome you. Today's guest is someone whose work is transforming lives around the world, especially for children facing cancer in the most vulnerable setting. Today, we are thrilled to welcome Dr. Carlos Rodriguez-Galindo. Dr. Carlos serves as Director of St. Jude Global, Chair of the Department of Global Pediatric Medicine, and the Executive Vice President of St. Jude Children's Research Hospital. He is also the co-director of the St. Jude WHO Collaborating Centre for Childhood Cancer. Under his leadership, the St. Jude Global Program has partnered with over 200 hospitals across 70 countries, which form the St. Jude Global Alliance, building a bold vision that every child with cancer, no matter where they live, deserves access to quality care. In addition to his work in global health, Dr. Rodriguez-Galindo's areas of clinical research expertise include retinoblastomas, sarcomas, rare cancers, and histocytic disorders. He has been the chair of the Rare Tumors Committee of the Children's Oncology Group and the president of the Histocyte Society, and has been the principal instigator of several institutional, national, and international trials. In this session, we will explore his journey, the future of pediatric oncology, and how African scientists and institutions can be part of this vital mission. Thank you so much, Dr. Carlos, for accepting our invitation and being with us today. So let's start. We have a lot of questions, and let's start with the first part about your career and personal journey. My first question, could you begin by telling us a little about your journey? What led you to pediatric oncology and global health?
Well, thank you so much, Wafa, for inviting me to this series of interviews, and congratulations to you and your team for all the success on the PAPERI initiative. So thanks so much again. And so, yes, happy to share a little bit my journey. Nothing remarkable other than, I can say that we are all the product of our education, our families, the environment that we grow with, the challenges that we face, but also the stimulation that we receive from the community that we are part of. And so I grew up in a family of where my father was a family physician. I was very committed to becoming a physician since early childhood, but also with that view, that feeling of a family physician. So I wanted to be very close to the people, to the families, to resolve their problems. Of course, that was my dream as I grew up. But then as I got into medical school, I became a little bit more interested in pediatrics first. And as I did my training in pediatrics, I became more interested, fascinated, if you wish, committed to the world of children with catastrophic diseases, those children that suffer, those families that see their children go. And that took me to cancer and catastrophic disease of the blood, sickle cell disease, thalassemia, etc. And that's basically where I decided to commit my career. And so I decided to become a specialist in pediatric oncology. That took me to St. Jude to do my specialty from Spain, where I grew up. I grew up in Barcelona. I should have started saying that, a small town in around Barcelona. And then, and that's basically where my career took me. And so as a pediatric oncologist, I trained at St. Jude. I grew, as you very well said in my introduction, Mostly in the field of clinical and translational research of pediatric cancer. And I was part of the research agenda at St. Jude. My career took me to Boston, where I was part of the Dana-Farber Cancer Institute and the Boston Children and the Harvard Medical School. And I spent a few years of my career there leading some of the clinical and translational research programs. But then I came back to St. Jude, and maybe that's part of the discussion that we'll be having, trying to fulfill my dream, my mission, that whatever I was doing was not complete until I could figure out a way to reach out to all the children of the world. And so that's my journey, starting with, the dream of being a doctor as a child, to then try to address some of the big challenges for children with cancer. And then that took me eventually to do global in multiple stages, if you wish. And it's a journey. I think our lives are journeys. And so we never know where that journey will take us. So anyway, so that's what it is.
Interesting. My second question for you, you now lead St. Jude Global, so one of the world's most ambitious initiatives in childhood cancer care. What personal or professional experiences prepared you for this role?
Yeah, and so that's a good question, Wilf. And I was kind of referring to this in the answer to your first question, that life is a journey, and we take challenges as they come. And I said we need to be brave. We need to be brave. We need to be um, um, comprehensive in how we approach the problems. But I think that um, there are different ways of getting into global health, as you very well know. There is, if I want to simplify it in two ways, one is the global health space, as, international organizations, global health agencies that dictate, that inform, that shape global health agendas. And that's a very common way of getting into the global health space. And that's what global agencies do. That's how maybe governments work, etc. I came to global health on the other side of that mirror. So I came to global health through the engagement in with patients. And so I always say I'm a physician. I work with physicians. My focus is the patient, and we shaped our program here at St. Jude Global with that lens, so that no matter what, whatever we did had to be extremely patient and family centered. So our global health approach was more from the bottom up than from the top down. And so from the bottom up, in the sense, engage with programs, make sure that we understand the problems that we need to resolve, develop and implement solutions, and work in partnership with institutions, with providers, with foundations, with governments to implement those solutions. That's how I came to global health. I'm not a global health expert. I did not have any global health training like many of our, you know, young generations have. I just came as a pediatric oncologist trying to resolve the problems of children with cancer. That's how I came to global health, trying to, step up in my, commitment to address the challenges of children with cancer, first at St. Jude in Boston. But as I was developing my programs, I realized that this was not complete, as I said earlier, unless I could figure out how whatever I did, whatever we did as a community, could reach out to all the children of the world. So that was the global health view that I had to develop from the patient perspective. I don't know if
Yes,
that makes sense. Yes.
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 Looking back, what were the most defining moments that shaped your vision for equity in childhood cancer treatment worldwide?
Yeah. So I think it was a to me, it was not a one defining moment.
Aywa.
I would
Yes.
say multiple defining moments as
Mm,
I grew in my career, as I realized the challenges that I was trying to conquer me as a community, but also as I started engaging with partners around the world. These were the most defining moments to me. The
mm,
engagement with people like me that were working young, middle-aged, senior that were working in different contexts around the world that were just like me, but in a different context, right? A pediatric oncologist in Pakistan or in Egypt, a pediatric oncologist that was training and trying to develop a program in Africa or in Latin America. These were the people that shaped me. I had that engagement as I was at St. Jude or then in Boston when people came for training. We developed these programs to facilitate transfer of knowledge, and people do observerships, and we tried to develop programs, and we started developing disease specific programs. Those conversations, those engagements shaped me a lot in terms of what is the reality, what is what are the heroes, the unsung heroes around the world that fight every day. And to me, I owe it to the children and to the people that take care of them. And that's the St. Jude Global program shaped around those concepts. There is something that I say all the time, or that we say, we tend to say, as you very well know in the literature, that we can cure childhood cancer. Actually, here in the US, we say we are almost at the point that we can say we have conquered the childhood acute lymphoblastic leukemia because we can cure 90% of the children. But that's a fallacy. This is not true because that's only for the children that have access to the care that is provided in high income countries or resource institutions. So if we want to cure childhood cancer as a concept, we need to cure the children that suffer cancer. And the same applies to children with catastrophic diseases of the blood, sickle cell disease, thalassemia, hemophilia. And so going from concept that we can cure, we know how to do it, to the reality of curing every single one of them, to me, that's the biggest challenge of our generation as pediatric oncologists or global health experts, how to bridge that gap.
Very interesting. Now let's start another point, global equity and vision. In one of your interviews with Oncology, you spoke about eliminating global disparities in childhood cancer care. So, what are the most urgent steps low and middle income countries can take now to improve outcomes?
Yes. So one of the things I've learned, Wafa, over the years is that while the program, the St. Jude Global program, started at this level of engagement with partners, with institutions where the patients are, the problem of childhood cancer, if we want to resolve it, is much more complex than that. I think we all understand that it's a multi-layered problem that starts at the hospital level where the patients receive care, but also has to be seen and understood in the context of the national systems, the health systems, but also at the regional level and at the global level. We cannot advance at a national level without a change in the global perspectives and understanding of how to prioritize childhood cancer. Like anything in this world, we all need to work together. There has to be a common message, a common priority, and we need to understand as a community all over the world that childhood cancer should be a priority. And so there are these multiple layers at the global health level, normative work, what WHO does, what global agencies do, what the governments do at the national level, but then how the community is organized to provide care to the children. And to me, the fight or the journey towards addressing inequities starts with this, by really truly understanding that this is a multi-layered approach, that one single intervention will not do anything or very little. Sometimes we focus on investing money or in changing policies at the national level or improving care in a center of excellence. The impact of these interventions is minimal unless we put it all together in a comprehensive manner. It's a whole package that strengthens the health systems, provides a very harmonious and harmonized environment where children can be treated and receive care, and then the centers of excellence and the capacity at the human resource level. So to me, that is critical. This comprehensive end-to-end solution, focusing on the patient journey, understanding the problems, developing and implementing the solutions, and then always thinking at what we call from the micro system to the macro level. So any intervention has to be seen as a intervention that needs to be generalized and needs to influence policies, etc. To me, it's very important as we engage with governments, with institutions. It's just everyone has to be around the table. Every single member of that multi-layered, structure has to be part of the solution.
Okay, so based on your answer, let me ask you another question. What role do you envision African researchers, institutions, and ministries of health playing in St. Jude Global's mission?
Yeah. So the St. Jude Global program, then, based on what we were discussing, tries to respond to this idea of that multi-layer approach. Well, we are a hospital working with hospitals. We understand that we need to address that entire, multi-layered problem, right? And so we at St. Jude Global, we work with institutions, with physicians, we provide support for development and implementation of packages that improve quality, improve diagnosis, improve psychosocial support, etc. But then we work with governments to help governments as well develop, because we have that content expertise, develop the national cancer control plans, the health systems packages, maybe the best buys from a cost-effective perspective, helping them develop the entire structure for the pediatric cancer programs to progress. We also work with WHO and other agencies in that normative work, the cure-all package, etc. So Africa is in a unique situation right now. We are witnessing this epidemiological transition, with the progress that has been made over the last, say, 2 decades since the Millennium Development Goals on maternal and child health, the drop in under 5 and infantile mortality rates have created an opportunity for our children to grow and develop. The competing risks of death that can be prevented through immunization, nutrition, antibiotics, etc., are slowly disappearing, and cancer is showing its ugly face, if you wish, right? So we need to be very sensitive about this epidemiological transition, because we see that happening right now in Africa as the agenda for maternal and child health, for prevention and treatment of communicable diseases is successful. Childhood cancer is becoming a problem, right? And what happens is that health systems, hospitals, programs have been mostly prepared to address the most common causes of death, which are preventable infections, etc. And now we need to develop a whole different system in terms of policies, referral networks, centers of excellence, universal health coverage, access to medications, workforce preparedness to start addressing childhood cancer. And so what St. Jude Global does is try to provide, if you say, I wouldn't say a solution, right? But a good opportunity for researchers, providers, governments, policymakers, decision makers to be part of that journey. And so St. Jude Global usually tries to provide the entire package, if you wish, as we work. We work with at a national level with all the stakeholders, try to develop these solutions. And the solutions, as we said, come in multiple different colors and shapes, from policy down to quality care. And so there is a unique opportunity right now in Africa for governments, providers, institutions, foundations, parents, organizations to create that momentum. And so we're happy to be part of that. We are seeing a significant interest and growth in interest in countries, particularly in sub-Saharan Africa, but also in Northern Africa, to be to be part of that movement that St. Jude Global, WHO, and other organizations are working on. The Africa CDC is also very interested in start addressing childhood cancer and catastrophic diseases. So it's a great moment. It's a great moment, Wafa, for young, middle-aged, old, anyone that wants to be part of this journey to address childhood cancer to come together and do a push in the next few years.
Interesting. So, are there any specific African countries or institutions that have made notable progress in pediatric cancer care through collaboration with St. Jude Global? And what can others learn from them?
Yes, no, there are many, many examples, and I don't want to leave anyone behind. Egypt itself has shown so much progress over the years, as you very well know. You have been part of that journey. So, but then if we focus more on sub-Saharan and Northern Africa, Egypt, Morocco have always been leading this field. But then there is a significant progress made in the French-speaking countries, particularly working with the GFAOP, with institutions in France, developing training programs in Morocco for all the French-speaking countries. In the sub-Saharan English-speaking countries, there has been a lot of progress as well. I think that I would say that there are two ways of measuring this progress. One is by the development of the human capacity and centers of excellence, and we see that happening with National Cancer Institutes, childhood cancer programs across the continent, but also how governments have heard that call and have engaged very meaningfully with St. Jude and other partners, but also with WHO through the Global Initiative for Childhood Cancer, creating that path for the strengthening health systems. I was recently, as an example, in Ethiopia 2 weeks ago, 3 weeks ago, and I had been in Ethiopia for the first time, probably 2012 or 2013. There was very little in childhood cancer care, very, very little. Just one institution, Black Lion in Addis, providing care to children with cancer, but with little support, little training, little resources. And 12 years later, through the efforts that many organizations like Aslan or St. Jude, suddenly we see an exponential growth in capacity with centers for childhood cancer in multiple cities, more than 20 or 30 pediatric oncologists in training in the region, and a commitment by the government to really address these gaps, setting up financial packages, engaging with the community to provide the resources that are needed, nursing care, etc. So I see that momentum building in many countries. We have seen it in Ethiopia, in Kenya, in Tanzania, in Uganda, in Ghana. We see it now in Senegal. We see it in Mozambique, in the Lusophone countries. So there is much more to do. I'm not saying that everything is done. No, it's just the momentum that is being built, and I think it's important that the governments see that it's important to invest in childhood cancer. And if you allow me here for 1 second, one of the works that we did as part of a Lancet Oncology Commission a few years ago, 5 years ago or so, was to do if you wish, a calculation, a modeling of what it takes to really do this comprehensive scale up that I was referring to. And it has a price tag. It has some dollars that usually are about 6 to 7 times the GDP per capita. So the governments can anticipate what would be the budgetary needs to take care of children with cancer. But then what's also important is that this investment is cost effective or very cost effective when we look at the DALYs, the disability adjusted life years saved along the road, because we are talking about young children. But then third is that there is a three three times return of investment, $3 per dollar invested in return of investment. So I think we have the tools now to engage with governments meaningfully, to also talk about budgetary investments and the return of investment of what we dedicate to childhood cancer. So this is something that governments in Africa are beginning to understand, so they can start thinking about how to allocate resources for childhood cancer care and control. Anyway, so hopefully that helps us. So long answer. So
Yes, yes, yes. Thank you so much. Now let's start talking about building capacity and partnership based on your answer. So, what are the most successful strategies you have seen for building sustainable pediatric oncology programs in resource limiting setting?
yes, that's a very good point, Wafa. I think it's critical that whatever we do as a community is developed with the perspective of sustainability and scalability, right? And for that, it's very important. Number one is what I said earlier, that multi-stakeholder engagement. It cannot be seen one institution locally or internationally working towards that goal. It has to be, we have to change minds, we have to convince everyone, we have to engage, and that is very important in messaging. So how to bring the stakeholders around the table, how to be inspiring, how to present the data that everyone understands, a government, the Ministry of Health, the Ministry of Finances, the Ministry of Education, but also the decision makers at the hospital level, at the regional healthcare level, how the foundations and the parents organizations, how the professional organizations can be part of that. So I think that assembling, articulating that multi-stakeholder engagement is critical. And for that, as I said, the messaging, the vision, the inspiration is critical with data-driven inspiration, if you wish, right? That's number one. And so number two is a true, genuine uh, engagement. This cannot be from the government, cannot be from the community only. It has to be from everyone. And for us as St. Jude, that we may be seen as the emulsifiers, the catalysts, but also we invest just to make things happen through our, resources. The point is empowerment. And so it cannot be done by just one organization investing resources. It has to be owned by all these stakeholders that are part of the discussion. So providing the tools for co-design, strategic planning, empowerment of the multiple partners is critical for success, because then it's owned both financially from a normative point of view, but also in terms of leadership at the local level. I cannot overemphasize that. I think it's critical that level of partnership for success and for sustainability. And so you need to have the governments completely on board with you. You need to have the civil society completely on board with you to help the governments with advocacy and resource mobilization. You need to have the pediatric oncology community to really prioritize that. And then you need to have, investors, additional funders that could be part of that. Anyway, so I hope that
You
that
need
makes
public private
sense.
partnership.
I agree. I agree. Public-private partnerships all the time. Yeah.
Okay, let me ask you another question related to this point. How can advocacy network like us, PAPERI, better support St. Jude Global's efforts in Africa, especially in bridging the gap between research, policy, and the community needs?
Yeah. So that's a good uh, comment. I think it's perfect segue to from what we were discussing. I think, we usually say that it takes a village to save the life of a child with cancer, right? And so the village is not a hospital, right? The village is a village, it's everyone in that village. And so conceptually, right, at a national level, at a global level, the point is that we need so many people to work together to save one life. And advocacy is critical to that. Advocacy, the groups of people with lived experiences, but also people that understand the problem and know how to mobilize the public opinion to create normative work. Without advocacy, I would say very little can be done. Not very little, but just probably the our efforts will not be fully completed. And so I think it's important to have a strong voice, as we said earlier, that can craft the right message. I think messaging is important, the sense of urgency, but also data. We need to have data, 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 data. And advocacy has to be built on data. And so we have to craft good message, has to be inspiring, has to be forceful, has to be able to communicate with multiple stakeholders. As advocates, you need to work with governments, but you need to work with hospital administrators or with investors. But then advocacy needs data, and data comes from research, from registries, from health economics, and so that advocacy needs to be that link between researchers, data sources, evidence-based strategies to put together the right advocacy package, and so only advocates can do that.
Thank you so much. Let's start to we can move now to another point regarding innovation and data.
Yes.
Now, how do you how do you see genomics and data sharing transform global pediatric oncology in the next 5 to 10 years?
Well, that's perfect. It's a perfect segue. I didn't prepare my messaging based on your question, but but it comes very nicely because I completely agree. We, the, um, we are in a world of data, right? Data informs our thinking, data informs our decisions, data informs our resource allocation, our prioritization, data informs our policies. But at the same time, data needs to be presented in the right way, needs to be comprehensive, cannot be skewed, cannot be biased, has to be done with the right resources, and has to be very inclusive. And so I think that I cannot overemphasize the need to really, really, really invest on data. And so data in many different ways, data that can be data at the health systems level, data can be at the patient treatment and outcomes level, data can be at the health economics level, data that can be at the institutional level, and data that can be at the genomic level, because every single piece of data is interconnected, as you know. So I think it's very important that whatever we do as we develop these national stakeholder engagement strategies to advance cancer, we talk about data and what type of data we need to make these decisions, how we start generating data because we don't have it, so that we need to invest in generating those data, and resources have to be allocated to generate those data as well. And so it has to be a very purposeful, proactive way of engaging with data. And then you can generate then the dashboards. You can provide for advocates, for physicians, for decision makers, do decisions based on data and adjust your plans based on the data that it's generated. And then to the other part of your question, which is the genomic data, it's critical. I don't think that, I think that data comes in multiple different forms and shapes, and not one is more important than the other. Conceptually, all the data is critical. But particularly now, maybe 10 years ago, we would have said something different. But today, in this time and age, with the progress made in genomic medicine, in understanding the causes of diseases, the causes of outcomes, targeted therapies, etc., genomic data becomes more and more relevant for everything that we do. I think it helps estimate the burden of the disease. It helps estimate the treatments and the outcomes. It helps estimate the toxicities. It helps estimate the epidemiology of the diseases that we deal with. So I think we need to invest as well in genomic data. At St. Jude, we are investing in that as well. And so the problem with genomic data, it is extremely expensive to generate the resources for proper genomic characterization of our population and the diseases that we treat. Um, and that comes in two ways. One is the technology that you have to put together, as you very well know, in sequencing, etc. But the other is the computational power that you need to really interpret those data in a meaningful way. And so we could spend an hour talking about that, but that's one of the strategies that we're doing at St. Jude, and we're working with partners in Africa as well on developing low cost or cost effective models for diagnostics of childhood cancer using next generation sequencing, novel technologies that are at low cost, and then using cloud computing capacity to analyze and provide diagnostics. And so, if we can advance in that field, then suddenly not only are we going to be providing optimal diagnosis for the children that we treat, but also generating a database of our population in Africa per country, per region, per disease that would help then allocate resources, develop better treatments, create centers of excellence, etc. So it's very important. I cannot say more about about data generation and genomic medicine, but the future is here. I would say people should not be scared about talking about genomic medicine in Africa because the future is here. We can do it. We are proving that can be done. The cost is not so extraordinary. We just need to develop the right strategies and then use capacity in the cloud computing for analytics to advance. So I think the future is here. I would not
Yes.
be afraid of that. Yes.
I completely agree with you. The future is here. So my question, data sharing will be related to the ethical part. So what ethical considerations should African institutions keep in mind when integrating genomics into pediatric oncology, especially with limited resources and infrastructure?
Yeah, no, that's a very good point. I don't think I have a solution because because the world is entering a very complex era in regulations, in data sharing, data protection. I think countries have to be very thoughtful about how to do that. To protect the data is priority number one at the individual level, at the national level. But at the same time, governments have to see the benefits that come with a very meaningful structure in terms of data sharing so that there can be proper analytics, comparisons, pooling of data for many different reasons. So I think the regulations have to be hopefully discussed at the national and internal at the continental level to create good uh, understanding of what progress needs to be made, how these policies and normative work has to be generated. I would say that this will be critical because there will be lots of opportunities for data pooling, but also centers of excellence for diagnostics that might provide support to 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 patients at the regional level with you know transborder collaborations. So I think that that's a big role for advocates as well, like your organization, to really think
Yes.
how to shape that regulatory environment. It's complex, and we see that all over the world, but I think it's manageable. So we are doing that in global. we have a global registry for childhood cancer that pulls de-identified data into a global registry. So, say institutions or countries own the data that these registries generate, but have the capacity as well of sharing de-identified data with a global registry that then allow us probably to look to a subset analysis at the regional level, at the continental level, at the global level, and the same for the genomic data. So as we engage with institutions to develop this capacity for diagnostics in genomic medicine, there is that capacity as well to share de-identified data with others so that we can all, analyze and develop decisions based on the data that we generate. So many countries in Africa are already in that path. Yeah.
So there are many countries actually in collaboration with you regarding registers for pediatric cancer. What about
Yes.
others who still not engaged or in this collaboration, not only for registers but for clinical trials? How can African countries to be more engaged in clinical trials and registers for pediatric cancer?
Yeah, I think that's a good question. And I think it's a progressive effort, right? So in my view, we cannot go from 0 to 100. So suddenly from not having any childhood cancer activity in a country to have clinical trials, right? So to me, it has to be a process that may take some time, sometimes years, in engaging the community, understanding the need to invest in childhood cancer, in developing local capacity, strengthening the health systems, and then generate the data to inform
That
future interventions. And so to me, all these can be shaped or understood in a research framework because research comes in many different ways. Sometimes we think about a clinical trial, but that's
mm,
just an example of it. Quality improvement initiatives can be seen as research. You know, uh, Communication efforts can be seen as research. Implementation studies using implementation science are also research studies. So the way we see it at St. Jude is that this journey of improving care, strengthening health systems is a journey of knowledge, right? So you need to generate knowledge, you need to accumulate knowledge, you need to share knowledge. And knowledge can only be generated if you develop the studies in the right way, your interventions, and that is research, right? So research methodology is critical and can be mixed methods studies, could be improvement sciences, could be implementation sciences, could be, epidemiology through a registry, could be cost-effective interventions, and then you do health economics research. So each one of those components in that journey is research. And it's important that as we engage with the communities, with the governments, we frame it the right way. Sometimes the word research scares people away because they think you are experimenting with me. But I think we need to be able to verbalize, communicate the concept of research as generating the evidence that you need to make decisions, and that is in multiple different ways. And that eventually leads to clinical trials as well. But I think it's easier then to just propose a clinical trial for a community, for a specific disease in an institution, if we have already been able to build the knowledge, the expectations that, what we do is research, what we do to improve the outcomes of our patients, to improve the communication with our families, to develop cost-effective interventions, to improve policies is already, if we do it the right way, we have to apply some research methodology and we collect data and we analyze data. So that's a research journey for me. And I think it's important that we are able to verbalize it, to communicate well, so that everyone from a government down to the communities and the advocates see the importance of generating this data.
Interesting. Now let's move to another important part, as this session will young scientists, African scientists will watch. So let's move to training and young scientists. What advice do you have for young African scientists and the clinicians working in pediatric oncology or cancer genomics?
Yes. So two things. First, I I would say there is, of course, I am a pediatric oncologist, and I would say there is nothing better than pediatric oncology. That in the point from the point that it's such a beautiful profession, that taking care of these children and their families is a challenge worth living, and that to do that it requires building an individual capacity that oftentimes takes years, and that is building your knowledge, whatever angle you come from. If you're a pediatric oncologist, you are a nurse, you are a basic scientist, you're a public health researcher, it requires understanding the problem, acquiring knowledge, practicing that knowledge, and working with teams to develop that. And that's a beautiful journey for any researcher that wants to tackle a big program. St. Jude understands that, and we try to provide a nurturing environment for anyone that wants to be part of that journey. So we do a lot of, educational packages for practitioners, for nurses, but also for researchers. We are developing research methods training that can be targeted to whatever you need. You can be interested in basics of research methodology, but you may be more interested in in biostatistics of clinical trial design or, biomarkers and things like that. And so, or implementation science or communication research. So we try to provide those opportunities for everyone that might be interested. And the second, we have also a master's program, a St. Jude Global, the St. Jude Global Scholars Program that trains health systems researchers, if you wish. Is a master's in global child health that is focused on health systems innovation. And so every year we have 10 students, and we have maybe every year 3, 4, 5 students from Africa that enroll in that program. So we have a large cohort of global scholars in
So, what is
sub-Saharan
the name
Africa.
of this program?
Yeah, it's the St. Jude Global Scholars
Oh,
Program. And
okay.
the St. Jude Global Scholars Program starts with a master's in global child health that has
Mhm.
components of health systems strengthening, public policy, cancer, epidemiology, etc. And then as the the students graduate, and it's 2 years. They don't have to move to Memphis. They just come here a couple of times a year. Everything else is online with mentors. Then they are eligible for what we call the Scholars Project, which is a thesis, if you wish, that then can be developed for 2 years. And usually it's about health systems strengthening, epidemiology, uh, cost-effective interventions, things like that. So I think that St. Jude Global can provide a lot of nurturing opportunities and career development and leadership development for many investigators and trainees and young professionals in Africa. So just reach out to us anytime, look at our website or reach out to me.
Uh, this is the answer of my next question, training opportunity. So you have a master degree in global child master. What is its name?
Global Child Health.
Global
Global
child head
Child,
master.
yes,
And second one, the second opportunity, training,
training. Yeah.
training program.
So, so we have to so in we realize that progress in childhood cancer and any other disease can only be done if you really focus as well on the people that will lead that change, right? So that's the workforce. And so we have multiple opportunities. We have the St.
Hmm.
Jude Global Academy. The St. Jude Global Academy is an entire academy that provides a very broad portfolio of educational opportunities from online education through the Cure for Kids platform that has
Yes.
courses, certificate-based programs, to also what we call the seminars or certificate-based programs that are hybrid between online education and then come to St. Jude for a week or 2 weeks for more transformational behavioral change. And that's more focused on, say, palliative care, infection control, leadership, things like that. And then we have fellowships. So we also
Mhm.
invest in regional training programs for pediatric oncology, for pediatric clinical care or surgery, that in partnership with regional institutions, academic institutions, so that then we train in that particular country, on that particular center for 2 or 3 years, trainees from the region. So all these are opportunities that we are very happy to share with anyone interested in Africa.
That's excellent. Now, let me ask you a question. If you could give one challenge and one opportunity to the next generation of African pediatric oncologists, what would they be? One challenge and one opportunity.
So I think the challenge and opportunities oftentimes are the same, right? It's just the two sides of the same coin. I think the challenge for us will be to um, to generate that momentum at the national and continental level. That's a big challenge. The
Mm,
momentum meaning that
yes,
everyone is behind you, that it's not just you in the institution, but really you get the community, the governments, the
yes,
continental
yes,
authorities. To
yes,
me, that's the biggest challenge. But at the same time comes with an opportunity because you are not alone, right? So it's there are many organizations that are focusing on that. St. Jude Global, one of them. WHO is part of that. We have the global platform for access to childhood cancer medicines that many countries in Africa are going to be benefiting from these global diagnostics platforms. So the opportunities are there. It's about taking advantage of those and working as a team, at the national or continental level. It's a very sweet moment right now. It's like all the stars are aligning for Africa to make uh, very rapid progress. I see a great opportunity, and I feel that the elements for that are there. So, as from a St. Jude Global point of view, we are committed to helping African countries, African practitioners, young investigators develop this better future. I can only emphasize that,
yes,
so.
great. Thank you. Now, let's talk about personal reflections, and I want to learn from you. What continues to motivate and sustain you in this work, especially when challenges feel overwhelming?
I I think I said that earlier, and I am not lying. It's to me, maybe for other people would be different. To me, what inspires me or what keeps me energized is people like you, people at the country level, in the hospitals, at the governments that are committed. To me, every time I take a trip, I came back re-energized. And so that's what keeps me going. That's what keeps me going. And knowing that I am not alone, that we are not alone, that there are so many people that love these children, that love this profession, that are committed to develop their careers, their personal lives, to the fight of for the lives of children with catastrophic diseases. And to me, that's it. I think that our pediatric community is quite resilient. I define myself as a very resilient person. I know that the future will come. The future is there. We just need to keep, uh, you know, moving forward and never give up because the
Mm.
children that we see, the providers that care for them, constantly inspire us. So I think that's what keeps me going: the children and the people that care for them.
So let me ask you another question. What does a truly equitable global cancer care system look like in your eyes?
So I would say a true equitable cancer system would be that, the true equitable would be that cancer system where any child anywhere would have exactly the same access to care and the same quality of care and the same chances of cure. That is a big, big, big ask. And right now we talk about equity and the work towards equity, but that's a long way to go. And so
Yes.
it requires the best of us to really, we cannot lower our standards. We can say, okay, we have reached equity just because we have been able to invest in access to medicines. That's not equity to me. Access to medicines is one component of equity, right? There is much more uh, for that. And so, uh, the Global Initiative for Childhood Cancer through WHO, through the Cure All technical package, already puts already the good framework about what equity could look like with the centers of excellence, the universal health coverage, the regimens and the optimized treatments and access to medicines, the proper monitoring with advocacy, good financing, good advocacy. I think that's the create already the path towards that equity.
This was my last question to you. And let me ask you if you have a special message you want to say to African scientists and pediatric oncology at the end of our session.
Thank you so much, Wafa. It's been great talking with you, and
Yes.
I would only say, for anyone listening or for anyone reading or thinking about that, what I started saying earlier, that this is a fight worth fighting. That this is a journey worth taking. It's a journey of knowledge, a journey of inspiration, a journey of success. I'm sure it is. Every day there are many children in Africa that develop cancer. Most of them die without even being diagnosed. And I
Yes.
said we all need to see that all these children are calling for us to answer their call. And if you start thinking about all these children that really are calling for us, the community, those that are in power, like us, power in the sense that we can do something through advocacy, through patient care, through financing, we need to answer that call. We need to answer that call, and that's critical. It's morally right. It's the right thing to do for our children. It's the right thing to do for our countries. The right thing to do for our communities and for the future. And it's worth investing the time. It's the most beautiful journey that anyone interested in listening would be able to take. And that childhood cancer, you don't need to be a pediatric oncologist to take care of children with cancer. There's so many actors, in advocacy, nursing, social works, policymakers, decision makers. Anyone in that village can be part of this.
Yes, thank you so much, Dr. Carlos, for such an enlightening and heartfelt conversation. Your vision for equitable childhood cancer care and your global leadership continue to inspire so many of us. We are deeply grateful for your time and for the work you do every day to ensure no child is left behind, regardless of where they live. To our audience, thank you for being part of this important dialogue. At PAPERI, we believe that knowledge shared is power multiplied. We hope you leave today feeling more informed, more connected, and more determined to advance equity in healthcare and research. Be sure to follow PAPERI on LinkedIn and YouTube and subscribe to our newsletter to stay up to date with upcoming Bright Mind sessions, courses, and opportunities to collaborate. Until next time, keep advocating, keep learning, and keep pushing boundaries of what's possible. Thank you so much.